welcome to the Psychedelics Investor. Tonight we're going to interview the CEO of Numi. Numi is a psilocybin company trading on the TSX Venture. The symbol is NUMI. The CEO's name is Payton Nyquvest, and we're very excited. So here we go. Hello, Payton. How are you today?
I'm doing well, thanks. How about you?
I'm doing very well, thank you. I really appreciate your time tonight. I know you're super busy during the day, and I happen to get you at home at night, so I really appreciate your time. And we'll keep this quick and snappy.
Cool.
Okay, fantastic. So I'm gonna jump right into it. So you had an incredible press release today. Could you explain it to us laymen's and tell us what it means? Just in layman's terms, what did that press release mean?
Yeah, so essentially, we have a narcotics dealer's license that's been amended to include a number of different psychedelics, including MDMA, psilocybin, mescaline, DMT. And under that existing license, Health Canada had granted us an exemption to be able to cultivate, extract, and produce psilocybin from the naturally occurring mushroom itself, the organic material itself, instead of a synthetic psilocybin, which is typically what's getting used in trials right now. It's exciting for us, obviously, being able to extract it from the organic substance is cheaper, creates a more cost-effective product and potentially a safer product because you're not having to deal with hazardous chemicals or anything like that. And, we also feel there could be interesting potentials with the entourage effect of different molecules that occur within the organic substance instead of just the synthetic substance itself.
Okay, great. Thank you, Payton. You and I have talked about this a little bit offline, and I think a lot of investors are sort of confused about the space and is it legal? Is it illegal? How can public company raise millions of dollars in a space that is maybe illegal? I mean, so tell us, what does that business model look like?
Yeah, good question. Right now you're in this sort of period of research that's going on. What you're seeing from those numbers that are coming out from the research that's going on is, FDA recently granted breakthrough medical status for MDMA and breakthrough therapy status for psilocybin, MDMA for post-traumatic stress disorder and psilocybin for mood disorder. The reason that the FDA typically grants those designations is to try and fast track those drugs through the FDA process. And what we're talking about is a federally approved therapy using those drugs within a therapeutic context. So to date, there's no, take your psilocybin home and give it a whirl in your living room. Really what we're talking about is approved therapies within a structured therapeutic context. So that's where it stands right now. These MDMA and psilocybin, LSD are all Schedule 1 right now, and so they are still illegal. But the potential for them to, potentially fairly short order, to be opened up for therapeutic and medical use seems to be really coming right around the corner. They've actually recently granted expanded access to a number of locations for MDMA in the U.S., which means there are groups in the U.S. that are providing MDMA-assisted psychotherapy before it's even finished going through the regulatory process. So it is very, very, it feels very, very close. And, with I think a number of groups coming into the space to continue to support research, I think you could potentially see that conversion happen fairly quickly.
Yeah, it's really cool. I mean, when I used to have hair, I took recreational mushrooms, and I didn't realize actually how much research was done in the past with psilocybin, LSD, and actually that Canada was a big part of it, and that a lot of the research was done in Saskatchewan, and I don't know if know this to be the case, but my research has sort of led me to believe that this was all sort of ended because of Timothy Leary.
Yeah, that was definitely a big part of it. Definitely a big part of it.
Yeah. So from what I understand, a lot of the early results that came out for those tests were extremely positive.
Yeah, I mean the body of research that, as you said, there's been tons and tons of trials that have gone on with psychedelics dating back to the 60s, and have continued. MAPS recently published a lot of their results from their MDMA work that they've been doing, and you're talking, don't quote me on the exact number, but it's up to an 80% success rate with treating post-traumatic stress disorder with MDMA-assisted psychotherapy, which is just, I mean, it's just a staggering number, and to be able to hopefully provide that sooner than later. I think that's really something that's very exciting. Cannabis, obviously going through its legalization process, there wasn't a lot of real research that was done with cannabis, whereas with psychedelics, I mean, the huge body of research is there, is really what's driving a lot of this movement, which is very, very exciting.
Yeah, there's no doubt that there's a movement out there. There's a lot of books coming. It's in the general zeitgeist. I mean, you turn on Netflix and there's a movie about famous people and their trips. There's books everywhere. There's Facebook accounts, Instagram accounts. So you really definitely see that there's a groundswell. And so it's going to be very exciting to see this unfold. So now that you have this advanced, let's call it an advanced license, is that fair to call it?
Yeah.
So what's the next step? Like, what do you do? What when you wake up tomorrow and the team has this license, what do you do with it?
Yeah, so for right now, what we're working on, or will be working on quite quickly, is developing the formulation for actually extracting psilocybin and getting it into a product form. And so that will be our focus sort of on the product side of things. And again, what I was mentioning before is we see these drugs as being approved therapies. So while, yes, we're focusing on the actual drug and material itself, for us, the real growth and focus of the company long term is providing clinical sites where we can actually provide that therapy for people, and be sort of the market for providing these different therapies. So sort of working on them both in tandem, but what we realized when we started the company quite quickly was, the actual drug portion of this work itself, there was definitely some focus that could be paid there, to be able to continue to develop that in parallel with actually being able to provide the therapy also.
I mean, that's great. I think if you're able to create the product and have the locations for the therapy, you've got, you've cornered the market. And I also really like the fact that you're not going down the synthetic route. I personally am a little bit spiritual, and I think that anything that the world has given us, whether it's a higher power, whether it's God, whether it's Buddha, whether whoever it is, Allah, that if you can extract that essence from a natural source and put that in your body, it's a much better way to go than doing it synthetic. So that's great. Well, congratulations to you guys. I'm super excited about this company. Full disclosure, I'm a shareholder, and I'm really excited to keep an eye on what you're doing. And I know you're busy, so I only have a couple more questions. So I think there's been a ton of interest in the small cap sector in psilocybin just recently. I mean, if you take a look at the volume in your stock today, and what you've traded since you've started, it looks like a bull market. I mean, you're doing some pretty serious volume. I know there's only a handful of companies in the space right now, and it's very early. I expect that will change. But I do see a lot of the early players in the cannabis boom are starting to jump in. There was a company today that announced in the space a $15 million bought financing, and it's done by Canaccord in Canada, which is the largest financing house in the cannabis space. So is it safe to say on a macro level that a lot of these investors believe that psilocybin and the rest of the psychedelics could follow the same route as cannabis?
I think, I think obviously there's definitely some nuances there. I think, you look at, I think what cannabis did more than anything is it opened people's perspectives to the fact that, drug policy change was possible, and that there was a new look at some of these regulations and restrictions. So I think if anything, that's really what's driven cannabis or driven psychedelics, was cannabis sort of opening the doorway for some of that thinking and some of the regulatory reform that you've seen. Personally, we think, psychedelics, yes, we're talking about drug reform, we're talking about, illegal substances becoming available. But for us, talking about mental health and the what we're talking about addressing with psychedelics, we feel that market is substantially larger than the cannabis market is. Whether you're talking about addiction, suicide, depression, anxiety, PTSD, these are some of the largest issues we have in society today, and those numbers continue to go up. So I think what psychedelics could potentially address is a really, really big problem, and something that could really, really, create a big impact. So that's what we see as really exciting.
Well, thank you, Payton. Yeah, because I think that a lot of investors are looking at this, and on one side they're saying, okay, so when cannabis started its pathway to legalization, let's call it, there were a few early signs, and if you were to look at the psilocybin space, it's mirroring a lot of those steps. So if we take a look at those steps, the first one was decriminalization in one of the United States. And now you have that in Colorado. Then, of course, to get cannabis through, the old guys in the Senate, they had to go through medical, right? I mean, there was no way that cannabis was going to have any sort of pathway of getting legalized in a recreational way without going through the medical process first.
Yep.
Getting the card and saying, oh, doc, I've got glaucoma, or my back's sore, or, oh, I'm having a really hard time sleeping, and people are getting their cards. So I think a lot of investors are thinking that part of it, but then they also look at it and say, well, if I take psilocybin, it's a much different experience. It's a much different commitment than just, smoking a joint. I like the fact that you're actually looking at this as more of a long-term medical and more of a real medical space rather than a pathway just to recreation. Because I like you, I believe that the pathway to recreational legalization of psilocybin is not going to move as quickly as the cannabis space, and I am a true believer in the power of psilocybin. I really think that it's going to change a lot of people's lives, and so I'm going to end it just with one more question, sure. and it's a perfect lead into this from what we're talking about now. I know that you have a personal connection to this, and I've seen a few videos and a few interviews where you touch on your personal connection, but you don't really get into it. I don't know if that's because you don't want to talk about it, or if no one's just wanted to go there. But I want to go there if you want to go there. Do you want to give me a little bit of detail on why you're in this sector, and what happened to you, and how psychedelics changed your life and put you on a path? I'd love it. I know my audience would love to hear it. If it's too personal, I understand, but I'd love to hear your story.
Sure. There's a few details I'll leave out. Just,
I understand
for certain reasons, but yeah, I personally I'd actually never had a psychedelic in my whole life. I came from a family that struggled with drug addiction, so I'd always sort of shied away from recreational drug use, especially around psychedelics. But I had been a long time mental health advocate. I'd struggled with some severe chronic pain issues my whole life, and always thought that they were somehow linked to my mental health, as I was struggling with some mental health issues as well. And I got myself to a point a couple years ago where no matter what I was doing to try and rectify my chronic health and mental health issues, I couldn't get relief from what was going on, and towards the end was getting hospitalized about once a week, and really was out of options. And I tried just about every medical Western modality that you could get your hands on to try and fix what was going on, and couldn't. And so turned to psychedelic therapy as a last ditch effort to try and save my life, and did so, and came out of that experience really just trying to figure out how I could give back to something that had saved my life. And I'm a young guy, but I've quite an extensive career in finance and funding new industries, and recognized that there was more that I could give than just simple philanthropy, and that's really why we founded Numinus, was to really try and make a bigger impact and really support this category. So it's very, very near and dear to my heart, and I know firsthand the what is potentially possible with these drugs. So it's very, very exciting.
Well, that's great, Payton. Thank you so much. I'm really excited to see what you do with this company, and excited to see it grow. And thank you so much for your time. We'll keep in touch, and thank you for what you're doing. It's really nice. I feel like with what's been going on in the world, with the inequality issues, and just the way the world's been a bit of a nasty place, and it seems on that road that everything's cyclical, and that the world needs a change, and it needs more socially conscious companies like yourself who are trying to help people in the most natural way possible. So you tick all the boxes, and I really appreciate your time, and good luck, and I hope that you'll be back with us to give us an update in the future.
Sounds great. Looking forward to it.
Okay, thanks again, Payton. Have a great night.
Thanks, you too.
All right, everybody, thanks for watching our video. Subscribe, like. We're on Instagram, we're on Facebook, and of course we have our own website. So join the website, and we'll send you all our updates and all our posts. Thanks again. Have a great night.